Hey, what's up, everybody? How's it going? This is Sean, and I just wanted to pop in here real quick. This is Tuesday. I don't normally do broadcasts on Tuesday, but I missed yesterday, so I wanted to come in here and give you guys a little bit of education. So, before we do, I just want to say thank you for popping in here. What I'm going to be talking about today is this concept of driving pressure. This is kind of a continuation of what we did last week, which is from the ventilator management fundamentals or vet management fundamentals, mechanical ventilation fundamentals, whatever you want to call it, doesn't really matter. This is just kind of introducing some of these concepts that you may or may not have heard about and just kind of presenting them in a slightly different way, in a way that hopefully kind of helps you solidify this concept that we are wanting to teach. So without further ado, basically I want to talk about just a few things here. We have to understand this concept of peak inspiratory pressure, plateau pressures, peak or positive end expiratory pressure. And then what we're going to do is we're going to bring these all together and we're going to talk about this concept of driving pressure. So when we have patients on a mechanical ventilator, we know that managing their airway pressures is important, right? And in a lecture that I do in one of the classes, we talk about what is more deleterious to our patients. Is it high peak inspiratory pressures or is it high volumes, right? And the truth of the matter is, if you are giving somebody too large a volume, that will ultimately translate to higher pressures. But imagine you were just simply giving somebody a breath too quickly and it was generating high peak inspiratory pressures. While that's not necessarily great for the lungs, that's not the pressure that the alveoli are seeing. So we need to kind of break this down, right? So let's first start off with this concept of peak inspiratory pressure. I'm just going to touch on it really quickly because most of you probably already understand this. This is the highest pressure throughout the entire circuit that the ventilator detects, whether that is actually in the vent circuit, whether that is in the main stem bronchus, whether that is in the alveoli. It is the highest pressure, but it is not necessarily the pressure that the alveoli are detecting. We can do what's called an inspiratory hold, whereby the ventilator will deliver a breath in, and at the point that it is switching from the inspiratory phase to the expiratory phase, it will pause. And what it allows the alveoli to do is basically they relax, right? If you think about the alveoli, expanding, and then when the breath stops, they then just kind of relax a little bit. And that pressure drops ever so slightly. And when it does, this is what you get on the pressure waveform. You get this slight drop in pressure to a plateau. This plateau is what we refer to as or we can actually measure this pressure as the plateau pressure. And this is the actual pressure that the alveoli are feeling. And this is the pressure that we really need to be careful of, right? So when we are ventilating our patient, we want to make sure that this plateau pressure is less than 30 millimeters. I think it's millimeters of mercury. It might be centimeters of water. I can't really tell, but I can't remember at this particular moment. But less than 30 is what we need to make sure that that pressure stays below. Okay. Peak inspiratory pressure, we generally say try to keep it less than 35, but the truth of the matter is, if the alveoli are compliant, meaning they are stretchy, they are healthy, the plateau pressure will be less than the peak inspiratory pressure. Here's the thing, the plateau pressure will never be higher than the peak inspiratory pressure, because if it was, it would be the peak inspiratory pressure, the highest pressure throughout the whole circuit. Important concept to understand, because if your peak inspiratory pressure, say, is less than 30, then you know that your plateau pressure is less than 30. You know your plateau pressure is within a safe zone. Okay, we talked about peak inspiratory pressure. We talked about plateau pressures. This other concept, this peak and expiratory pressure, right? This is the pressure that is remaining in the airway at the end of exhalation, peak and expiratory pressure, right? So it is a pressure that the ventilator will preserve in the lungs during the end of exhalation. And what that does is it keeps those alveoli open, right? You've probably heard the term atelectasis trauma, right? Which is where the alveoli collapse because there's no pressure being maintained within them during the exhalation phase. And so they kind of stick together, and as the ventilator delivers the next breath, those alveoli are kind of popped open. The surface area of the alveolar tissue tends to stick together. It can cause a lot of tearing forces. It can cause a lot of inflammation. And so this peak and expiratory pressure keeps those alveoli open. There's other reasons why we deliver PEEP, and there's other reasons why we increase the amount of PEEP, primarily to improve oxygenation. But here's the thing. In the past, we thought that according to the ARDSNet protocol, right, and you can go and learn about that at ardsnet.com, I think it is. I'll put a link in the comments section afterwards. But they talk about low tidal volume or lung protective strategy, right? Whereby we should be delivering somewhere between 6 mLs per kilo and 8 mLs per kilo of tidal volume. And this is so that we are not over distending the lungs, right? And in, the whole goal is to properly inflate the lungs without overinflating them, right? And keeping this plateau pressure less than 30. Now what we've actually discovered is that there's this other concept called driving pressure. And the driving pressure is the difference between your PEEP and your plateau pressure. That driving pressure, if it is above 15, then we start to see trauma to the lungs, or this ventilator-associated lung injury. So what we need to think about is the relationship between the PEEP and the plateau pressure, and keeping that total pressure less than 15. Now, how do we do that? If we have stiff lungs and we are still appropriately ventilating our patient, we may have plateau pressures that are in excess of 20, 25, approaching 30, right? We don't want to go above 30. But if we are keeping our PEEP at that 5 mark, imagine this. We have this plateau pressure of, say, 25, but our PEEP is still down here at 5. We have a driving pressure of 20, right? That is our driving pressure. That is doing damage to our lungs. How do we correct that? We can bring down the tidal volume so that our plateau pressures are not quite so high. That's one way to do that. Or we can increase our PEEP. So if you bring your PEEP up to 10, you help recruit more of those alveoli, you improve oxygenation, but you also reduce that driving pressure. And that driving pressure has been shown to play a significant role in the ventilator-associated lung injury. So keep those plateau pressures less than 30, keep that driving pressure less than 15, adjust your volumes, adjust your PEEPs accordingly, and do your best to keep the patients from developing further lung injury. All right. I hope you enjoyed this. I hope that kind of shed some light on this concept of driving pressure. If you like that, leave a comment below. I see that there's some of you watching, and I would love to say hello to you. You can always leave a comment in the comments, and it will pop up on the screen, and I can actually show that to the rest of our viewers. If you are watching on Facebook, please do me a favor. Head on over to our YouTube and our YouTube channel. It's The Medic Lab. And click subscribe, like this video. We're trying to grow our community on Facebook so that we can kind of transition a little bit away from, we're trying to increase our community on YouTube because it's going to give us a lot of opportunities to do some really cool things on YouTube that we can't do on Facebook. Anyways, I hope you like this. If you did, let me know in the comment section below, and I will be back hopefully on Thursday with kind of an open coaching session. So if you have anything that you want me to cover on Thursday, leave it in the comment section below. Thanks, everybody. I sure do appreciate it. Have a great rest of your day.